Hi everyone, I'm Linnea John and I'm doing a video on 645 evaluation summary of my clinical experience. I would say that the best part of my experience is that I learned what a book simply could not teach me. Um, I learned the business aspect of practice. In my therapy rotation, I learned I never wanted to be understaffed and unknowledgeable about every aspect of my business. The therapist I worked with had an office manager that quit on her, and then she had a series of audits all on all of her programs. And she didn't know what was going on in her program, so she was like running around last minute trying to get people to tell her what she needed to know, and that was an invaluable lesson. She shared with me that she lost a contract in the past because her therapist didn't do treatment plans, and I thought that was like, you didn't know your therapist should do treatment plans. Even as a nurse, that I knew that, but the thing was, no one was checking behind her therapist because she was overbooked and she had lots of other things to do. She also had a nursing component that she was providing for clients in her Texas home living, as far as medication teachings and stuff like that, and auditing the MARS and doing nursing assessments. And she was still trying to figure out how to bill for that. So she was providing services that she was not getting paid for. So I definitely learned that aspect of business, that you need to know how to do everything. Even at this point, she was still applying for more programs. She had to literally work day and night to keep income coming in. Like, she was always applying for programs, and then overbooking herself. She also did speaking engagements and things of that nature. No time to complete anything 100%. And I learned that that's something I don't want to do. I want to be well organized. Now, juxtaposed to the psychiatrist that I did my prescribing rotation with, his office worked like clockwork. He precepted medical students, which he also got paid for. And he precepted NP students because he wanted to open 5 more offices. So he was trying to basically orientate NP students so when they graduate, they would come work for him. And they would be trained the way he saw fit. And he didn't have to pay for the orientation. He also had more than enough staff. He also knew every aspect about billing, like what insurances he takes, what insurance he doesn't take, where they're going to do second insurance billing, which they did not. He knew every aspect. Like, his staff would come and ask him, do we take this? Can we do that? He was on top of that, even though he still had a third party to do his billing. He would accept large amounts of new patients. He wouldn't turn down any patients because he had students who did all the new admits, and he had lots of rooms. He had a huge office space, so he could pump a lot of patients through in one day. And a lot of these patients were paying cash for the first visit because they were considered emergency visits through a company or place called ZocDoc to see if a doc takes your insurance. But these were emergency visits, so it was like $245 a person, and he would spend literally 15 minutes, and the student would spend 45 minutes getting all the information. And he would just come in and ask a couple questions, give him a diagnosis, and things of that nature. Some other things that he did is he cut costs by training staff who had no prior knowledge of the medical field. He didn't even have medical assistants doing his work for him. He had like young girls who would take minimum wage, and he would train them to do everything in the office. He would even train them to do things that to me weren't appropriate. From both experiences, I would say I have learned to staff my business with the appropriate people and learn how to do everything so that I'm not dependent on if someone walks out. I know how to bill. I know how much everything costs, just from the beginning to the end. And just to let my staff know, if you don't know something, let me know. I know that I need to do audits, and that if I have an office manager, I will just have the office manager doing office managerial work, not doing 10 million jobs, half doing them and then saying, oh, this isn't done, that isn't done. People walk out on you if you overwork them. That's just the truth. And then to the psychiatrist's point, people walk out on you if they feel like they're doing more than they're paid to do. Like, they took a job for one position and then you have them doing 10 other positions. The biggest thing I learned is that one cannot do or offer services for free. If you want to fully staff your office, you have to be able to pay people. And you can't do anything for free. You can't fill out any paperwork for free. You can't make copies and things like that for free. And billing is a big part of a successful business, because if you're giving services and you can't get paid and you can't get reimbursed and you can't pay your employees, you just get a bad name. And I would say that that's the biggest thing that I've learned. I would say the worst part of clinicals was at the therapist's office was there was always a state of urgency or emergency. There was always an audit coming. There was always something that she didn't know, which I felt she could have avoided if she hired more staff. The worst part of the psychiatrist's office was I was standing on my feet literally for 9 hours. And he worked the NP students harder because our school didn't pay. And it's like we were auditioning for a job. So he really, really wanted to know, did we know what we were doing? And so by the time we graduate, he could just send us into one of his clinics, and it's a smart idea for free orientation or, free audition for a job. And you're still adding to his business by doing all these new assessments and, being knowledgeable about it. I wish I could have done my prescribing rotation with the nurse practitioner. I would say that I'm very disappointed about how long it took to get the contract with MHMRA. And it would have been with someone I knew and feel comfortable with. And I wouldn't have been auditioning for a job or feeling under so much pressure, more of an environment where I could just learn and feel free to ask questions and not feel like I'm at a job interview, basically. But I'm still grateful for the opportunity, and I still learned a lot despite the circumstances. Some critical things that I learned about prescribing, I would say, I feel like I am prepared to help patients with brief therapy and medication management. I learned to max out one medication before starting another medication or titrate a patient off of medications. Not just completely stopping the medication. And then you can also add another medication slowly. So while you titrate down, you titrate up on another medication so they just won't be left with any coverage. And you can mix medications that do the same thing. They can be on two medications that do the same thing. If you start, and I learned to start them at a very low dose, because you'll get to a ceiling real quick on psychotropics. So start them out very small and then bring them back in a week and see how they're doing, like far as side effects. You don't want to start the patient on the quote-unquote book dosage right away. That's what I've learned. That's not in the books because they give you initial doses, and the doctor that I work with like to start people off on lower doses than initial dosage. I learned to start mood stabilizers with antidepressants because they give a quicker result for bipolar patients. You don't just want to, because they're in a depressed phase, just to put them on an antidepressant with no mood stabilizer. I learned how to catch drug user patients, like people who are just there to get drugs and they don't want to give an accurate history. Some people, you can look at them and tell that they have drug abuse, or their conversation is geared more towards what certain drug they want. And I would just simply say, if I tested your urine right now, what would I find? And then a lot of times I would get the truth that way. I would definitely recommend a therapist to up and coming students. She was great far as her wealth of knowledge and her patience and the laid back environment to where you could learn. But the state of emergency, I think that's probably over. I think while I was there, all of her programs got audited, so it should be fine for the next people coming in. I would not recommend the psychiatrist to other students, just simply because he takes advantage of free labor. You will definitely learn, but you will also feel overworked. You may not enjoy the clinical. He's not a mean person, but he's about his business and his money. So he wants you to complete those assessments back to back, and and stand there. And he doesn't really take a break. So, the therapist worked with me. The therapist that I worked with took Medicaid, Medicare, self-pay, and she also had contracts with CPS, Texas Home Living, federal probation. She did individual, family therapy, group therapy, anger management, and mental and substance abuse assessments. She also did motivational speaking. She asked me to create a teaching PowerPoint for issues I felt her clients needed help with, and I did a parenting, self-esteem, how parents could help their children with self-esteem, things they could do. Because I was seeing a lot of parents just, even in the therapy sessions, put their children down. What she doesn't do, she's bad at this, and it just wasn't any positive talk to the children, and I felt that needed to be addressed, so I did that. She felt that was lovely. Her style was transformational and inspirational, and she allowed me to see patients on my own, so I really did like that. I did get some autonomy. The psychiatrist I work with mostly he worked with private insurance, PPOs, and self-pay. He also had contracts with disability and CPS. The clients we cater to were more upscale. We're in the Sugar Land area. 50% of the population is Caucasian. And it was the suburbs. I felt that he saw the patients too frequently. Once a week. It's like, how can you have clients who work and other things like that? But we would get the people in and out. Like, literally, if you had a 2 o'clock appointment, you would be seen at 2 o'clock. But I still felt like it was too much. He gave us a lot of autonomy too. He would let us write prescriptions and decide what to prescribe, and go in and actually tell the patient in the role of a provider, which I thought was great. I feel once I study for the boards, I will be ready for practice. This program was so accelerated that I really need to take time to study for boards. I have changed my mind towards doing things for clients for free. That's what I've changed my mind since I've started these clinicals, because now I see the business aspect of practice. I've been exposed to dealing with a gamut of clients, and I believe I can deal with any patient now, low end to high end patients. I thought I would not want to work with borderline personality disorders, but it's different than working in nursing, because a borderline can mess up a whole unit. But now I know that if I can't get along with a patient, I can close their chart and give them a referral out, and that's good. And then you just set limits. Overall, I learned a lot in this experience. I feel like it's needed, and it's an invaluable lesson. Thank you.